Knock, knock. Hello, my name is Morgan. I am a student with Southwest Tech. How are you today?
Pretty good.
Can you verify your name and date of birth for me?
Joe Smith, 10/15/53.
Awesome, Joe. And are you allergic to anything?
Sulfa.
All right, well, I won't be giving you anything with sulfa today. I'm just going to verify here with a second verification, and your wristband looks like it verifies that. I'm going to put your bed up here. Joe, are you having any pain?
It's an 8.
All right. Well, it does look like I have a doctor's order here to give you some pain medicine. So I'm just going to wash my hands here. Have you had any pain medicine within the last 24 hours?
Nope.
All right. Because this pain medicine can only be given every 4 hours. So making sure we're not overdosing you here. And I will be putting on gloves later in the procedure. I do not need them at the moment. And you said you have not had any pain meds in the last 24 hours, and your pain is an 8. So it looks like I'm going to give you some Demerol here. And you have an order for 100 milligrams every 4 hours as needed for pain, rated 5 to 10. And the way this works, Joe, is it binds to the opiate receptors in the CNS, and so it's going to alter the way you feel and respond to pain, while producing a generalized depression of the CNS. So that's why it takes away the pain for you. Some side effects that we should be monitoring include seizures, anaphylaxis, confusion, sedation, vomiting, nausea, and hypotension. And with that, I'm going to check your vitals here.
All vitals are in normal range.
All right, so it is good that I can administer this. And this may increase your plasma amylase and lipase concentrations, but that isn't anything we need to worry about right now. So, Joe, today I'm going to give you your injection in your ventricle gluteal, which is, to find this, I am going to find your hip bone and place my palm over it, make sure my thumb is facing forward. And this triangle right here, this is where the injection will be for the ventricle gluteal. You can also give it in the vastus lateralis, which is typically used for children. And to measure that, I would take my hands like so and divide it into 3 sections, and so right in this general area, the middle section is where we would administer that one, but like I said, that's for children, so we won't be using that location. And then you can also administer it in the deltoid. So you would, to find that one, you would take your pinky and you would find the bone here around your shoulder, and this is backwards for me because you can't really measure it on yourself. So you would find your pinky here with the bony area and go down 1 to 2 finger spaces, and you would draw a line with your armpit line here, and it's going to create a triangle right here in this general area. And since your upper half isn't present here, I'm going to give it in the ventricle gluteal muscle. And so I am first going to check all of my supplies to see that they are all intact, no holes, not have been used, and my needles look good. I'm going to use a 22 gauge needle today, and it's about 1.5 inches long, and I need to use a needle that long so that I can get it into your muscle instead of the tissue surrounding. And I also have a blunt fill needle here, which is the needle I'll use to withdraw the medication from the vial. So first here, Joe, I am going to cleanse the top of the vial for 30 seconds. 30 seconds has passed, and I am now going to put gloves on. And I am going to verify that I need to withdraw 2 milliliters because this Demerol is 50 milligrams per 1 milliliter, and you have an order for 100 milligrams. So that to give the correct dose, it would be 2 milliliters. So I can now begin with opening up my packages here. And I'm going to switch the needle to the blunt needle so that I can withdraw medication from the vial. And I am now going to draw 2 milliliters of air, and I'm going to remove the cap. The cap, and I'm going to inject it into the vial and put the 2 milliliters of air into the vial and withdraw 2 milliliters here. My vial is getting sort of empty here. Alright, and we do have enough. We have 2 milliliters here, and I'm going to do my first check that you, Joe, have an order for 100 milligrams of Demerol, and I have Demerol 50 milligrams per milliliter, so I have 2 milliliters here. And because this is a high-risk medicine, I'm going to verify with another nurse to have them do a check for me.
Looks all good to me.
All right, and now I'm going to perform a second check here. And I have the Demerol 50 milligrams per milliliter. You have an order for 100 milligrams, so I have 2 milliliters. And that looks good. I'm going to state my 5 rights, Joe. I have the right patient because you are, in fact, Joe Smith. I have the right medication. It's still the Demerol. I have the right route, the right dose, because I have calculated 2 milliliters, and the right time because you have not had any pain meds within the last 24 hours. So that was my 5 rights, and also checking for my 3rd time. I can now remove the needle from the vial and recap the blunt needle using a box here to recap. And I'm going to remove that here. And put back on the 22 gauge needle that we are going to use for injection. And I'm just going to set that down, and I'm going to cleanse the area, Joe. And this medication should work within 15 to 20 minutes. So I'm going to come back and check in around that time after we do this. I'm going to find the hip and make sure my thumb is forward, and it's going to be right in this area here. And I'm going to clean with a circular motion for 30 seconds. And 30 seconds has went by. I'm going to use my alcohol wipe here just to point to the area that we cleansed so that it can dry and I don't lose my placement. So now, Joe, I can remove my cap because it has in fact dried, and you're not an incredibly small person. You seem to be a quite larger person, so I'm going to inject this all the way in at a 90-degree angle. And so I'm going to use the Z-Track method. I'm going to pull the skin back so that it is tight here, and I can now inject the needle. And I'm just going to pull some back here, Joe, to make sure I haven't hit a vein. And I haven't. There is no blood, so I can now, over 20 seconds, begin to inject the Demerol here. So I use 20 seconds because I have 2 milliliters of the medication. Alright, and now I'm going to wait 10 seconds here to withdraw the needle. And I'm going to get my gauze ready. And I'm going to withdraw the needle and apply pressure. And I can now safely cap my needle and dispose of it in the sharps box. And I have held the gauze. You're not bleeding. I can remove this gauze here. How are you feeling, Joe? Are you doing okay?
Yep, doing fine.
All right. And I'm gonna remove my gloves here. And I'm going to lower the bed. Do you need anything else while I'm here, Joe?
Nope, I'm good.
All right, and because this is a PRN medication, I need to chart on the MAR what time I gave it and my initials. So gave for a pain of a level 8. And I can come back and check with you in a bit to see how that's affecting. And you don't need anything else?
Nope.
All right, sounds good. See you later.